Oh, you said you're good? All right. No worries. Thank you all so much. Thank you so much. Good afternoon, everybody. I'm Congresswoman Summer Lee. I represent Pittsburgh's 12th Congressional District. And I'm proud to be here today to talk about some common sense solutions to in the work that we have been doing towards them for building a true community safety agenda. We know that every single successful movement is built by and for the people. And that's evidence in this very coalition that is working to end poverty and violence and desperation that's making our communities and our homes less safe. The folks here know that when we talk about community safety, we have to talk about why our communities have been marginalized and left behind. We have to talk about the discriminatory policies that have created these cycles of harm and the inequitable distribution of opportunity and access and wealth. We can't talk about community safety without addressing the lack of affordable housing and the special interests that stand to profit from it. We can't talk about community safety without recognizing the mass incarceration crisis that rips families apart and puts money in the pockets of the private corporations. We can't talk about community safety if our young people are constantly being criminalized and pushed out of schools just for doing things that young people do. And we can't talk about community safety while our neighbors are still being shot anytime they're experiencing a mental health crisis. These aren't radical ideas. We all know that. These are the bare minimum. And at the bare minimum has to include policies that invest in people, not just in police or prisons, but to keep our communities safe. That includes our Black and our brown and our indigenous, working class, disabled, and low-income neighbors, the very people this government has neglected and harmed for too long. The very precise policy decisions that have exacted these cycles of harm that we are experiencing today. So we have to invest in the basic needs that folks are still being denied: safe schools and safe streets, quality health care, mental health services, affordable housing, economic mobility and stability. We have to reform our criminal legal system. We have to reunite families and ensure that they're being taken care of. That's why I'm proud to help launch this agenda, and with it to reintroduce the People's Response Act. This legislation puts an emphasis on inclusive, holistic, and health-centered approach to public safety. That's data-backed and evidence-based. It will create a division of public safety within the Department of Health and Human Services. This would fund, conduct, and coordinate research, technical assistance, and grant programs related to non-carceral, health-centered investments in public safety. And I'm grateful to my sister in service, Cori Bush, who entrusted me with this bill. In an unprecedented era where wannabe dictators are dismantling federal government as we know it, we have to recommit to advancing justice for our collective communities. We can't allow the harm to outweigh the healing. Our people deserve to live in dignity, to feel safe, to feel supported. With this movement, this community safety agenda, I know that we will get there. So I thank you all so much for being with us, for your persistence and your consistency, for showing up and continuing to push even when it seems like we're going against the tides. I want to look to see who we have yet. We don't have, oh, he's right here. You're right on time. I want to introduce Representative Stephen Horsford, our Chair Emeritus of the Congressional Black Caucus.
Right on time.
Yeah.
Good afternoon. I am Congressman Stephen Horsford. I'm proud to represent Nevada's 4th Congressional District that includes Las Vegas and central rural Nevada. And I want to thank my colleague, Representative Summer Lee, and my colleagues in the Community Violence Working Group, and this group of incredible advocates who are here today for taking a stand for safe communities. I'm not at this podium because I'm a member of Congress. I'm not here because I'm a gun safety advocate. I'm here because I'm a son whose father was taken from me and my family far too early by gun violence in the community that I grew up in and the community that I now represent. I was just 19 years old when my father was shot and killed. He was working as a cook at a local convenience store. Someone went into that convenience store with ill intentions, and he took a bullet to the chest and died on the way to the hospital in an ambulance. I can still remember receiving that call. It's a call that too many families have to endure in this country. A call that we wish we could prevent. But here's the shameful truth. The United States of America has gun violence and incarceration rates that are unheard of in any other rich country in the world. We're alone in allowing 47,000 of our friends, neighbors, and loved ones to die to the scourge of gun violence each year. We're alone in a ludicrous political dialogue about whether the solution to overwhelming gun violence is more guns. We're alone in refusing to address the fact that gun violence disproportionately affects communities of color, forcing historically disadvantaged communities to remain hardest hit. Now, research has shown that there are solutions. Community-oriented intervention programs coupled with common sense violence prevention policies can cut violence rates in urban cities in half in as little as 2 years. That's why I'm proud to be a driving force, along with my colleagues, behind the Break the Cycle of Violence Act, which would invest $6.5 billion in anti-violence programs and workforce training and job opportunities, because the best alternative to a bullet is an opportunity. And it's the driving force behind this community safety agenda, which I'm proud to say includes my bill. The data around community violence intervention isn't hard to understand, but apparently this administration and Republicans here in Congress missed the memo, or more likely, they simply don't care. More than 365 grants, approaching $1 billion in funding that we appropriated, not Donald Trump, which are designed to save lives, make communities safer, and prevent crime, were stolen by this administration. Community violence intervention isn't a line item to plunder. It's a lifeline for communities and residents. It's tried and true method for de-escalating violence on the streets and preventing recidivism so that people can build a brighter future. So we need leaders, all of you, thank you, who understand that. And since we clearly don't have that in the White House or in the leadership here in Congress, we need advocates like the young people that I'm proud to share this podium with today. We need to speak up, we need to speak out, and we're here to demand that human life take priority over their next empty Doge promise. So I'm proud to stand here with all of you to say enough is enough. We have the solutions in the community safety agenda, and now is the time to pass these bills and to save lives. With that, I will turn it back to my colleague, Representative Lee.
And I'm going to say that I'm not going to introduce everybody because we do have a thing on the podium, but I'm going to make one slight edit, and I would like to introduce Representative Ayanna Presley from Massachusetts, and then if you will.
Yes, absolutely. All right. Let me read that. We can have safe homes, hospitals, streets, schools, communities. As I have so many times when in the presence of movement family, I'll center the moment and myself with the words of Angela Y. Davis. I'm no longer accepting the things I cannot change. Instead, I'm changing the things I can no longer accept. Good afternoon, movement family. It's good to be here surrounded by such a committed coalition of justice seekers, table shakers, movement builders that make up the community safety agenda. Time and again, organizers like all of you today have stood in the gap, fighting to reimagine America's flawed approach to public safety in a way that puts our communities first. Thank you to my brilliant and indomitable sister in service, Congresswoman Summer Lee, for convening us today. Thank you to my advocates and my colleagues in service, Representatives Horsford, Scanlon, and McBath, for their partnership. The community safety agenda, yes, it is a mission, but it is a mission born out of a movement that has long pushed our nation to center the dignity and humanity of all people, A movement that is unrelenting, unwavering, and unafraid in our pursuit to challenge racist, ableist systems of oppression and inequity. A movement that is needed now more than ever. We need an approach to public safety that centers care and compassion, not cruelty, not criminalization. And let me say, with this administration hell-bent on attacking immigrants and separating families, if you are fighting against mass deportations, you should also be fighting against, well, actually, they're mass kidnappings. There's no due process, so it's not mass deportation. But the point is, this is all a for-profit system. So if you care about mass incarceration, you should care about mass kidnappings or deportations. These are two sides of the same coin that are driven by a for-profit system. For far too long, our most vulnerable communities, and especially black and brown folks, have been subjected to surveillance, brutalization, and incarceration when they should have been met with care, justice, and healing. Our nation has long perpetuated a system rooted in hurt and harm. We treat trauma with more trauma. We treat trauma as a threat, and we meet pain with punishment, all in the name of so-called public safety. But there's nothing safe about ignoring and incarcerating someone in the midst of a mental health crisis. There's nothing safe about criminalizing a student's normal adolescent behavior and putting our children on a pathway to confinement. There is nothing safe about letting law enforcement profile, brutalize, and murder people without consequence. But we continue to see this violence every day. Just this weekend in Massachusetts, in the Commonwealth, a man in mental health crisis was tragically killed during an encounter with law enforcement. Tragedies like this one are preventable. They are a painful reminder of why we need policies like my Mental Health Justice Act and People's Response Act, which takes a public health approach to public safety and would help save lives. This work, like so many of us, is deeply personal to me. My father, now a retired accomplished author and former college professor, was absent from my formative years because he had an addiction that was criminalized. Rather than being met with compassion and care, my father's addiction was met with criminalization and incarceration. There are so many people today, black and brown men like my father, who are battling addiction or otherwise in need of care. And by imprisoning them, we are missing out on their brilliance and innovation and all the contributions they could be making to society. We have a moral obligation to put an end to the generations of policy violence that is literally killing our people. Today, we fight for every individual who has been met with brutality, with criminalization, with suffering, when they should have been met with care. We will not let up on our pursuit of justice. The community safety agenda is an acknowledgement of the harm and a powerful step toward healing for those harmed by our unjust criminal, legal, and policing systems. With the support of this broad coalition, I introduced the People's Response Act with Congresswoman Lee to take a trauma-informed public health approach to public safety. It's well past time that we confront our country's mass incarceration crisis head-on and transform our unjust criminal legal system. Mental illness is not a crime, and it's time we stop treating it as one. Today, Trump and Republicans are showing us daily what it looks like to legislate hurt, harm, and oppression through their mass deportation agenda, harmful executive actions to unleash law enforcement, and unprecedented assault on black and brown communities. So we stand here as proof of what it looks like to legislate equity, what it looks like to legislate healing, what it looks like to legislate justice. We will not back down. And I'm all right with this heat and being uncomfortable. That will ensure that none of us ever grow complacent in this work. So nothing wrong with being a little bit uncomfortable. And with that, I will invite to the podium Thea Sebastian, Executive Director, the Futures Institute. All right, thank you.
Thank you so much. Good afternoon, everyone. My name is Thea Sebastian, and I lead a nonprofit organization called the Futures Institute, which does policy research and advocacy to create safe, thriving, connected communities. For the last 4 years, I have also been leading a coalition of 100 organizations across the country, working to advance a federal community safety agenda, the very agenda that brings us together today. We all know what safety feels like. Safety is sitting on your porch, watching your neighbors stroll by. Safety is kids playing in the street outside, nobody needing to watch them or care. Safety is letting your kids walk to school, not worrying what'll happen on the way, not worrying that they'll make it through the day, and not worrying that when they get home, they won't have a place to sleep or food to eat. And truth is, we know exactly how to make this vision come true. Overwhelming evidence shows that when we invest in the root causes of safety, in housing, mental health, streetlights, parks, youth centers, summer jobs, and more, we stop violence and harm before they happen. Evidence also shows that cutting-edge community safety programs can break the cycle of violence long-term without landing more people behind bars. Plain and simple, these strategies work. In some communities, violence intervention, which sends credible messengers to help de-escalate, prevent, and reduce conflicts, has reduced gun violence by as much as 70%. In other communities, strategies like alternative crisis response have caused a 34% drop in low-level crime while taking a major burden off of police. And investments in the upstream social determinants of safety, like jobs for teenagers, housing, and treatment, have proven our highest impact and most cost-effective way to improve public safety while increasing economic opportunity. This is the vision that the Community Safety Agenda embodies. The 7 bills in this agenda touch nearly every issue that evidence shows to comprehensively, cost-effectively break the cycle of violence. Through the Mental Health Justice Act, we have a bill that would send trained professionals to manage crises that stem from mental health or substance use, helping all people to receive the care that they need. Through the Break the Cycle of Violence Act, we have a bill that would invest deeply in violence prevention and intervention, including jobs programs that can help people chart a different path forward. Through the People's Response Act, we have a bill that would invest in all these life-saving measures while building the institutional architecture, a new division of community safety at the Department of Health and Human Services that can sustain these investments over time. And through the other bills, we have deep investment in the other areas, summer jobs, housing, and preventing family violence that evidence shows to keep kids and communities safe. But all that promise is hanging in the balance right now. This spring, HHS announced a major restructuring and layoff of 10,000 people, including deep cuts to the agency that leads our research on preventing violence. Not long after, the Department of Justice terminated millions for organizations that work on violence prevention, victim service, and other life-saving programs. And just 2 weeks ago, this Congress passed a budget that will decimate both Medicaid and food security, a cut whose safety consequences will have ripple effects for years, even generations to come. In short, the stakes couldn't be higher. The need for an evidence-based safety agenda couldn't be greater. And the importance of standing together, of recognizing how these bills chart a different future, couldn't be clearer. We're not trying to pass a few bills. We're trying to grow a movement. Because quite simply, that is what these bills are. The community safety agenda isn't just a few policies with a common theme. They're a comprehensive vision of what safety could and should look like. Our kids deserve those safe streets, safe schools, and safe places to play. They deserve a world where they can just be kids, not live in fear. I support this agenda because I also want that future, and I know that these policies and this collective movement for community safety is our best way of getting there. For that reason, I couldn't be more grateful to be here, joining all of you as we continue this fight. Now, I am delighted to introduce Representative Mary Gay Scanlon.
Thank you. I'm Mary Gay Scanlon. I represent Pennsylvania's 5th District. Thank you for joining us on this very hot July day, and it's probably appropriate because we know that July is the month when we see the highest rates of gun violence because high temperatures, hot tempers, and easy access to guns are just a recipe for disaster. I want to thank my colleague from the Commonwealth, Representative Lee, for gathering us here. You know, if there's one thing that I hear from constituents from my very first day in office, it's that they want to feel safe and actually be safe in our communities. And if there's one thing I hear from local law enforcement every time I meet with them, it's that they can't do it by themselves. Our communities are crying out for real solutions, but too often all they hear from DC or Harrisburg are messaging bills, slogans, and scare tactics designed to score political points rather than provide real solutions. So it's time for an honest conversation, and that's what this group is trying to do. When safety is concerned, the stakes are too high not to follow what research and evidence and those on the front lines in our neighborhoods are telling us is required. It's not about blame, it's about change, and it's about support. So let me talk a little bit about what my bill in this package addresses. For years, underinvestment in our communities has meant that police and schools have been asked to take on problems far beyond their mission and for which they do not have the capacity, the training, or resources. From homelessness to gun violence to mental health, no one group can solve that. And it's what police officers have been telling Congress for years. We're hearing the same thing from community members. Too often, people are afraid that by calling for help and putting police in a position they're not trained for, it risks escalating an already dangerous situation. When someone has a mental health emergency, it's not responsive, fair, or smart to use resources to have law enforcement be the default response. If we're going to prioritize community safety, we have to find ways that allow local law enforcement to focus their time and energy on what they do best, serious crime solving, and things that they're trained to address. But that's why with my colleagues I introduced the Mental Health Justice Act. It's a common sense solution that makes it easier for state and local government to send trained mental health professionals when 911 is called because an individual is experiencing a mental health crisis or substance use crisis. The bottom line is we know this works. We've seen promising steps towards this model in programs I've been able to secure federal funding for in my own community with support and cooperation with our local law enforcement. Programs like Delaware County's Mobile Crisis Co-Response Pilot Program, which has been successfully de-escalating situations for those in a mental health crisis. And programs like Delaware County's Overdose Response Team, which serves as a vital safety net, providing and support for those in crisis while easing the burden on overworked medical and emergency service providers. So I'm proud of the early successes of these programs, which are promising steps in the right direction and proof that it's time to pass nationwide legislation like the Mental Health Justice Act for all Americans. The American people, law enforcement, our community activists all agree individuals experiencing a mental health crisis need to be connected with mental health services, not thrown in jail. Mental illness is not a crime. We have to stop treating it that way. So I'm looking forward to introducing the Mental Health Justice Act later this Congress and continuing to partner with Representatives Lee, McBath, Presley, Horsford, and others in championing approaches that address the root causes of violence and offer our neighbors in crisis the care and compassion they deserve. So thank you for joining us today. Now I would like to turn this over to Beatrice Beckford, the National Director of Youth and Family Justice with Moms Rising.
Good afternoon. My name is Beatrice Beckford. I serve as National Director at Moms Rising, and I'm here today on behalf of Moms Rising and our members, standing proudly alongside my colleagues of the Community Safety Working Group, grassroots leaders, and champions in Congress who are sponsoring bold legislation to reimagine safety in our country. At the heart of this message is a simple truth. Everyone deserves to be safe. No matter where you live, no matter the color of your skin, no matter how much money you make. But for far too many communities, especially Black, brown, low-income, and disabled communities, the systems meant to provide safety have delivered harm instead. We've relied on policing and incarceration alone to fix problems rooted in trauma, poverty, mental illness, and divestment, and it hasn't worked. Policing in America has expanded massively over the past few decades, with state and local governments spending $129 billion on policing just last year. But more police has not meant more safety. Study after study shows that increased police presence and funding have little to no correlation to reduced crime. In fact, more policing brings more harm, especially in communities of color, and the safest communities don't have more police, they have more resources. So today, we're saying let's do this together. It's time to stop throwing money at a broken model and start investing in what actually keeps us safe. The good news is that a safer future for us all is not just some far-off dream, but a vision that is already being built by communities across the country. In Denver, the STAR program sends behavioral health professionals, not armed officers, to respond to 911 calls involving mental health issues, homelessness, and substance misuse. The result? A 34% drop in low-level crimes where the program operates, and not a single arrest in over 1,000 calls. In Chicago, the Treatment Not Trauma movement is organizing to ensure mental health emergencies are met with care, not criminalization. Their goal is simple and powerful: reopen public mental health clinics and create a 24/7 non-police response team trained in crisis care. In New York and Mississippi, credible messenger programs are giving young people a chance to break the cycle of violence and incarceration by connecting them with trusted mentors, often people who have lived through the same struggles. These programs work because they're rooted in trust, not punishment. Mobile crisis teams in cities nationwide are responding to emergencies with clinicians and social workers instead of officers. They are preventing arrests, reducing ER visits, and saving lives. And offices of violence prevention like those in Newark and Philadelphia are deploying community members, people who know the neighborhood, who understand conflict, who carry credibility to interrupt violence before it escalates. In Newark, this public health approach has contributed to a significant drop in gun violence and firearm-related hospitalizations. These aren't just promising ideas. These are proven solutions. They reduce harm, they prevent violence, and these programs build the kind of lasting safety that our communities deserve. But right now, these programs are at risk. Federal funding for community-based public safety is on the chopping block, facing devastating cuts despite incredible results. This threatens the progress we've made, and it puts real lives in danger. We cannot afford to roll back the clock on care, prevention, or progress. We need more investment in these solutions, not less. That's why today we're calling on leaders of Congress to support the community safety agenda, which highlights the following critical bills. The People's Response Act, championed by Representative Summer Lee, would create a federal division on community safety within HHS to fund and coordinate public health-based safety efforts nationwide. The Mental Health Justice Act would empower communities to send trained mental health professionals instead of police to crisis situations, because mental illness should never be a death sentence. The Break the Cycle of Violence Act funds community violence intervention programs that have already helped reduce gun violence homicides. And the Counseling Not Criminalization Act would help schools invest in counselors, social workers, restorative justice, because kids need care, not cuffs. These bills reflect the vision that moms, families, and communities are calling for, a system that invests in people. We're asking Congress and elected leaders across the country to stand with our communities, to fund what works, not harms, to help us build a future where when a call for help is met with the right response. Moms, caregivers, young people, advocates, and community leaders are already doing the work. We just need you to meet us with the resources, legislation, and courage like the representatives here with us today to make real safety possible. A safe future isn't defined by how many people we incarcerate, but by how many people we lift up. Let's work together to reimagine what safety looks like for our communities. Real safety in our communities will take all of us. And we don't have to choose between safety and justice. We can and must have both, because everyone deserves a safe walk home, a peaceful night's rest, and a tomorrow full of promise. Thank you. And it's my honor and privilege to introduce Representative Lucy McBath.
Well, good afternoon. I want to say thank you to my colleagues that have been here today, and to the advocates, to the leaders that are standing behind me. Thank you for gathering, Representative Summer Lee. Thank you so much for gathering such a fierce group of advocates for safer communities. Access to housing, food, and safety are among our most basic human needs. Yet in thousands of communities across this country, people cannot readily have access to them. These are everyday struggles that millions face just to survive. They are not abstract issues. They are urgent, real concerns that should be top of mind for anyone who wants to bring about lasting positive change. Because when we talk about building a better, safer, more vibrant future, one not riddled with violence or fear, we have to start by investing in people. Investing in their basic needs, in their dignity, in their futures. That means increased funding for public health, greater access to quality education, and stronger protections for our social safety nets. When we prioritize these initiatives, we reduce harm. We reduce fear. We all want to feel safe. We all deserve to feel safe. We all want to belong to communities that are thriving, not just surviving. The truth is, when we help connect people to strong foundations with stable housing, food security, and safe neighborhoods, we don't just help individuals. We uplift entire families, entire communities. We strengthen neighborhoods. We transform cities, and we protect future generations. That's why I am so very proud to be here today for the launch of the Community Safety Agenda, a bold, evidence-informed approach to prevention that prioritizes meeting people where they are and helping them rise. Across the country, thousands of advocates have been doing this work on the ground, and some of them are right here behind me. And now we're bringing that work forward as a united, organized effort across Congress. This isn't just a new initiative. It's a values-based framework designed to do what's right for our communities and for our country. It's about building systems that serve everyone, not just a lucky few. It's about having the courage to reimagine what safety and prosperity can truly look like when they are rooted in compassion, equity, and care. We're here because we believe in safer futures. And we know that the answer is prevention, not detention. Because when we invest in our people, our communities thrive. And at this time, it is my distinct honor to introduce to you Mr. Kevin Beckford, Ph.D., Senior Associate, Pretrial Justice Institute.
Good day, all. My name is Kevin Beckford, and I'm speaking on behalf of the Pretrial Justice Institute, a BIPOC-led, BIPOC-powered organization that believes real safety is born from dignity, not detention. We're fighting for a future where care replaces cages, where community comes before criminalization. Let's be real clear from the jump. Jails do not make us safe. Police do not make us whole. What creates safety is housing. What creates safety is healing. What creates safety is investing in our people before a moment a crisis ever arrives. But instead of choosing care, oftentimes this country chooses control. All across the nation, we are watching budgets be balanced on the backs of our communities. Programs that save lives are being defunded. Organizers are being silenced, and black, brown, and working class folk are being blamed for the very conditions they've been forced to survive. That's why this community safety legislative agenda is more important now than ever before. It's urgent. These bills aren't just policy proposals. They are a declaration that we believe in the genius, the strength, and the sovereignty of the people. Each of the three bills entailed in this agenda is a brick on the road to liberation. Let me break a few of them down. First, the People's Act. This act is about shifting power. It moves federal dollars out of the punishment and into the hands of local healers and community-led first responders. It puts money where it matters, into the hands of organizations building safety from the ground up, not the top down. Second, the Mental Health Justice Act. Too many of our loved ones are locked up in jail cells when what they need is a therapist, a warm bed, and consistent care. This bill funds trained professionals, not badges and guns, to respond to the people in mental health crisis, because crisis is not a crime. Third, the Break the Cycle of Violence Act. This is an investment in what we know works, violence intervention led by credible messengers, by folk rooted in community and not bureaucracy. These programs have saved lives, ended retaliation cycles, and built peace where the state only offers punishment. We don't need more police, we need more possibility. Let's be honest, these bills won't fix all the harm that's been done over the years, but they move us towards a world where our people don't have to beg for safety or trade their freedom for care. They move us towards a world where we finally answer the call that made black folk, indigenous folk, and poor folk across the country have been making for generations. Invest in us, and we will keep each other safe. Thank you to the Community Safety Working Group for your bold leadership, and to everyone here today. Let's keep pushing. Let's keep organizing. Let's keep building a world where we don't have to recover from, because we all deserve that, all of us. At this time, it is my pleasure to introduce my colleague, Nick Wilson, Senior Director of Gun Violence Prevention at American Progress.
Thank you, sir. My name is Nick Wilson, Senior Director of Gun Violence Prevention at the Center for American Progress. It's an honor to be here with many of our champions for gun safety and community safety in Congress, as well as my colleagues and advocates from around the country, from the public health, gun safety, criminal justice reform movements, uniting together for this important agenda. I really want to delve into just one of the bills, even though they're all very important. We heard from Congressman Horsford about the Break the Cycle of Violence Act, which would bring over $6 billion over 8 years for community violence intervention programs. These programs focus support on the individuals at the highest risk of being involved in violence and connecting them with resources and services that can transform their lives. These evidence-based programs offer a complement to law enforcement and have contributed to historic declines in gun violence, sometimes between 30 and 50% in cities that have scaled up and their investments in these programs. These programs can save taxpayer money as well as lives. When properly implemented and sustained, for every $1 invested in CVI programs, a community can save up to $41. Now, CVI is a new term, but cities relied on street outreach of credible messengers to interrupt escalating tensions and prevent retaliation for generations in this country. These frontline public safety workers have deep ties to the community, and they can reach people that even law enforcement sometimes cannot reach. Violence prevention and intervention programs have expanded rapidly across the country in recent years, largely funded by unprecedented federal investments championed by leaders in Congress, many of whom stood with me here today. But without increased federal, state, and local investments, these life-saving programs are destined to shrink or even disappear. States are increasingly trying to keep programs alive by allocating funding from state budgets, including last month $2 million in the Texas budget that was signed by Republican Governor Greg Abbott. But federal funding is urgently needed to sustain and expand these proven programs. With the Trump administration recently rescinding over $100 million in already granted funding to violence prevention nonprofits, and today House Republicans advanced their extreme bill slashing funding for CVI programs as well as other programs to prevent violence among youth, women, and everyone. This is more important than ever. So I urge everyone to call their congressperson and encourage them to co-sponsor the Break the Silence of Violence Act, because now is not the time to pull back from these life-saving programs. It's my pleasure now to introduce Liz Kumar, the Sentencing Reform Counsel for the Sentencing Project.
For more than 50 years, the U.S. has pursued mass incarceration as its answer to public safety. The U.S. prison population has grown nearly 500% in the past 50 years. That approach has not only failed to deliver lasting safety, it's deepened racial injustice, destabilized communities, and drained resources from the very things that prevent violence: housing, mental health care, youth development, education, and economic opportunity. Extreme sentences are not the path to justice or safety. We can move away from reactive, punitive responses towards strategies that actually reduce harm. That includes investing in community-based violence interruption programs, expanding non-police crisis response teams, supporting youth outside the justice system, and strengthening the social supports that make people and communities resilient. The Community Safety Agenda reflects this vision. We urge Congress to stop creating new mandatory minimums in pursuit of safety and invest instead in evidence-based approaches that center care, healing, and prevention. This is not a theoretical proposal. It's grounded in decades of data and practice. We know what works, and we know that safety doesn't come from cages or criminal records. It comes from connection, resources, and dignity. And now it's my honor to introduce Michael Huggins, Deputy Senior Director at Color of Change.
Good afternoon, everyone. I really want to thank so much Representative Lee for her leadership on this, and all of my colleagues and advocates. My name is Michael Huggins. I am Deputy Senior Director of Policy and Government Affairs at Color of Change. Color of Change is the nation's largest online racial justice organization dedicated to reducing harm against Black communities. At a time when Congress is choosing to invest more in billionaires than it is working class individuals, we are at Color of Change are so proud to support the Community Safety Working Group's agenda. We are also very much dedicated into making sure that all of the bills and this agenda become law. Black people deserve to feel safe in their homes and communities like so many other communities. And we need a model of community safety that is rooted in public health and seeks to eliminate harm. But despite the evidence that punitive interventions make us less safe, we continue to invest more in tough on crime tactics. More police and more funding for police is not going to make our communities safe, and it's time to shift that thinking and promote something that is actually going to be effective. In particular, we are very excited about the reintroduction of the People's Response Act, which would fund evidence-informed community safety programs proven to reduce harm for Black people. The PRA emphasizes an inclusive, holistic, and health-centered approach to public safety by creating a division on community safety within the Department of Health and Human Services, because communities and experts agree that public safety is a matter of public health. The PRA provides these necessary and critical resources and assistance to scale up inclusive, holistic, and health-centered approaches that actually are going to transform our communities. But despite the clear benefits of investing in our communities, the government continues to give billionaires more money, more resources, and more tax breaks, and refuses to invest in things like healthcare, access to food, higher ed financing, housing affordability, all things that have been proven to actually make our communities safe. And the people are noticing. The government is choosing to build wealth for billionaires on the backs of our communities and safety, and it's time to change it up. Investing in community health, alternative crisis response, violence prevention, safe and affordable housing, economic stability, education, youth and families, community infrastructure, and addressing other community needs is not only common sense, it is a matter of life and death. It is critical in building the kind of transformation that our communities require. So I stand here with my fellow advocates, and I urge Congress to take up this agenda and start investing in our communities. And I think I might be the last one. I'll kick it over to Representative Lee.
You may. I feel like, of course, everything that needed to be said was said at this point. If there is anything else that needs to be asked, this would be the moment to do it, though it's 200 degrees out. Keep it in mind. All right. All right, thank you all so much. Thank you all so much.